Welcome to this March 2025 edition of GAAPP Academy, Winning Advocacy Communications. I'm Tonya Winders, the President and CEO of GAAPP, and it's my pleasure to welcome you today. So again, today I'll be moderating the facilitation on winning advocacy communications together, and I am so excited to welcome alongside our speakers. I will say, if you are using, I should back up, I'm sorry, I think it bypassed this. We are using Wordly now for translations, so you should be able to see a shared link that has been dropped into the Wordly app and into Zoom that you can hear this presentation in your own native language. All speakers will be speaking in English, but if you would like to have the translation, you can do so now through the Wordly link. Choose View and follow the instructions as outlined here. So again, welcome to our speakers today. I'm excited to introduce them. First, we have Kelechi Nwangoro from Asthma, Nigeria. He is a seasoned public administrator with more than 20 years of leadership and development experience. And as the Director of Operations for Asthma, he is dedicated to improving public health initiatives. Beyond his professional achievements, Kelechi is a devoted family man, married and proud father of 3 boys who are all impacted by asthma. And so really appreciate his opportunity to be here with us today. Next is Lakki Limbu. Lakki is with the Care Association of Nepal, and he is the COPD project leader there. In this role, he leads initiatives to raise awareness, promote early detection, and advocate for policies to address the growing burden of COPD. He's pursuing his medical education at the Nepalese Institute of Health Sciences, and he works on school-based awareness programs, youth leadership training, and community screenings. These efforts empower individuals to take charge of their health and advocate for cleaner air and better healthcare access. And then finally, help me welcome Gabriel Johnson from the Instituto Unidos pela Vida of Brazil. Gabriel has worked with nonprofits over the last 9 years, and he has his degree in journalism and marketing and a postgraduate degree in digital marketing and project management. He's studying for his master's in communication sciences at the University of Porto in Portugal, and he began defending the interest of cancer patients and currently works as an advocate for patients with fibrosis, rare diseases, and respiratory diseases. He's also operating various projects and campaigns for awareness, advocacy, and access in Brazil. So welcome to our speakers. As we get started on the importance of awareness in communications and advocacy, I wanted to first just level set on what are some of the current areas that we as patient advocates can actually impact. Now, I forgot, we're going to have a question in the chat that you all can respond to, and Kristen Willard will be monitoring that. So the first question is, what does the term advocacy communications mean to you? So why don't you drop that in the chat right now, Kristen, and let everyone respond to that question. What does advocacy communication mean to you? So when I think about the role of patient organizations in advocacy, it really has significantly expanded over the last 5 to 10 years. It can include their areas of influence, but especially it's how we are involved in decision-making bodies as they set priorities and opportunities to really shape policy development in a wide range of institutional settings. So things like drug safety, clinical research, HTAs or access issues, the regulatory framework, policy, lived patient experience, peer support, and capacity building. The role of patient orgs has truly continued to expand over the last 5 to 10 years, and we expect that to only continue in the next decade. So actually, GAAPP has worked alongside, again, in the European realm to outline exactly how patients are currently involved in the whole life cycle of drug development. So from the very early stages of research priorities, research design and planning, to research conduct and operations, to that regulatory affairs and HTA assessment, and then ultimately getting a drug approved, in market, disseminated, and communicated, as well as monitoring that drug post-approval. So there's a number of different ways that it's appropriate for patient involvement in research and development and in this advocacy communications realm. So that's what we're going to focus on in this edition of GAAPP Academy today. So how do we approach this evidence-based advocacy model? First, it's about advocating in a targeted, evidence-based, well-educated, and professional way, and really measuring the impact and the outcomes of what we do. We know that things have to come together in the perfect storm, if you will, in the center of this diagram, this Venn diagram. We have to have the right message with really good data in a very targeted advocacy manner in order to get the outcomes and results that we're looking for. So how do we engage with stakeholders? And I think there's some of this that's missing, actually. Maybe it will build, maybe not. I don't know what happened on this slide. But what I'll say with you is that we, need to do more than just share our own personal experience. Yes, our lived experience is important, but when we're meeting with government or stakeholders, it's important to use not only the emotion of our own personal experience, but also scientific evidence and economics to support our argument. And the reason is because advocacy stakeholders, especially government and stakeholders, have limited resources that they're trying to allocate in one area or another. And so it's vitally important that we not only share our lived experience, but that we share the evidence and the economics to support our advocacy ask and position in these communications. So now this has built here, and you can see that this is the way that we influence decisions more effectively, where we balance this lived experience alongside the evidence and economics. So I always want us to start with the end in mind. What are we trying to achieve in these advocacy conversations? Remember your why. Don't ever forget why you're doing this. It really matters that we connect with the heart first, and then the head in setting our objective and asking what is that final goal, and then how do we get there? Also, ensure that your skills and your knowledge are up to date. Generate or find the evidence that you need to support your case, to support the thing that you're asking for with the government influencers. Identify who those key decision makers are and understand what's important to them and how they operate. And then design a specific strategy of engagement and collaborate. Ask for help. Very rarely do we see that policy is changed by one individual acting independently and alone. So it's important to build collaborations, to build alliances and coalitions, and to advance your policy priorities in a very strategic fashion. One way that we're doing this at GAAPP that I wanted to share is in regard to the lung health resolution. This is a World Health Assembly resolution that will be entertained and voted on in May of 2025. And you've seen email communications from GAAPP about the integrated lung health resolution, but we've developed a toolkit that has an outline of the key aspects of the resolution that you see here. It also has sample letters that you can send to your government officials, to your member state representatives, asking them to sign on and support the lung health resolution. And it has social media assets to help get the community activated around this. There's also a change.org petition that you can link to and sign on and encourage your community to do so. It is 50 years since we've had a lung health resolution that was not related to tuberculosis. And so now is the time in 2025 to ensure that we're speaking up for chronic respiratory diseases and encouraging our member states to actively support and sign on to the Integrated Lung Health Resolution that will be addressed at the Health Assembly in May of 2025. Now with that, we're going to go to our examples from our member organizations. And I'm excited to first welcome Kelechi Nwangoro from Nigeria. Kelechi? Do we have Kelechi?
Yeah, I'm online here. Can you hear me?
Yes, we can hear you. Can you see the slides and begin your presentation?
Yeah. So I can go on now?
Yes, please.
Okay. So happy to be here. Thank you so much for the opportunity, given to Asthma GAAPP, to be. It's an individual, towards conquering asthma in Nigeria in partnership with people, with asthma and all who share their concerns. And, we've been on this for a very long time. This is about 20.
Okay, it appears that Kelechi,
I
think we may be having some internet.
Yeah. Okay.
Your internet seems
to
go in and out. Your internet seems to be cutting in and out. Could you perhaps turn off your camera and just have the audio? I think that may help us.
Okay. Okay, I think okay, can you hear me now?
Yes, you can continue.
Okay, yes, yeah. So like I was saying, this is an organization that have been involved in this advocacy for years, for close to 25 years. And, like I've always told people, I said the passion why we started this was because, I lost my twin brother as a result of this. And, my dad and my senior sister. So it's a passion thing. It's something that, it cannot die. We must have to do this advocacy. And that is the reason why, Asthma GAAPP is really in, for this. Okay, so we started this in 2020, and fortunately we are a member of GAAPP, and we've benefited so much, through GAAPP. And our area of focus, will be in the area of direct communication with companies. We've, one of the major areas of advocacy that really worked for us, was direct communication with potential companies and organizations that could sponsor a program, and also sending asthma awareness activities to newspaper companies, and TV houses for consideration for free publicity. This was because, there were no social media, forum during the time that this, organization started. So, we built these organizations they've been helpful, and all other channels of possible publicity. Then our initial major challenge, which we've conquered now, though, our major challenge at the inception was non-availability of funds, and we've conquered that now. For our logistics, which included transportation fares, small funds for banners, flyers, and other publicity, material. Our founder, was Mr. Gochuku, started with the team visiting schools and engaging them in simple asthma education, asthma awareness lessons, and most importantly, taking pictures of the sections. We later use the pictures to write sponsorship letters to the identified companies, appealing to them for any form of financial assistance to enable us, to continue our activities. So these are some of the things that are some of our challenges, our initial major challenges, like I said, which we have surpassed. We have passed, that now. And, so let's move to the next slide. Okay, and it worked. worked. It worked because, while we're doing that, companies started responding in various degrees of financial donations, and even media organizations, started inviting us for live interviews. And, we started visiting more schools and started sending our reports to even international agencies and get recognition from World Health Organizations, GINA, and Asthma CAP UK. If you look at, some of the pictures, you will see a picture, a recognition letter from World Health Organizations, getting our books, because we actually did medical guide for nurses and doctors, which World Health Organizations helped. During that period, they actually purchased 10 copies of it, which really boosted our morale and helped us in moving forward. So we subsequently were even invited to the World Asthma meeting, that held in Chicago, USA in 2001. So we've been in this advocacy for a long time. So we took our challenges head on as an individual asthma organizations, because the other 4 asthma organizations were too slow for our pace and later fizzled out of existence. And in Nigeria here, we created all our publicity materials by ourselves, and always try to highlight the burdens of asthma and the many resultant asthma deaths due to non-awareness of self-management of the condition. So that's it for this. So we move to the next slide. Oh, okay, beautiful. So this is how we actually started. You can see some of our programs. These are some of the things that we, that really helped us to, to get to where we are, because we were meticulous with reports. Whatever that we do, we always, take cognizance that people are funding us, and we always have to show them, that yes, that, this awareness was actually done. And these are some of the school programs. These are just a little about some of the school programs that we have done. In what you see, that's one of the major boosts that we had. When we were actually coming up, because World Health Organization, it's not just a small organization. It's an organization that recognizes excellence and reporting. So when by the time that we were able to convince them that yes, truly Asthma CAP has come to stay, so they were able to to get some of the books that we wrote. That's one of our major booster. Thank you. So let's go to the next slide. Our key motivation was our compassion for asthma patients. Like I've said this, I am so compassionate about this because of my twin brother that died. That is my major booster. I cannot just sit back, and watch children die anymore. And if I had known what we know now, those things would not have happened. And that's basically why Asthma CAP is majorly doing what we are doing. So it was difficult, to watch asthma patients struggle in ignorance when we knew we had information to help them. This led us to publish the book Asthma, the Family Handbook. Focus, in resilience, belief are our main ingredients. We live with anyone that is involved in this field of health. It's a thing of great joy that organizations like GAAPP, and others have reason to support active organizations in this, because I think we are really doing, what is needful at this particular time. So we are, in all that we do, we'll always acknowledge GAAPP, because if not for you, just few that last year we were able to produce a whole lot of asthma book. And in conclusion, I say that it is important that you start self activities independently and document your activities. and then reach out to relevant companies and organizations with details of your work, because that's basically what made us who we are today. So we are so grateful for where we are now, and we look forward to getting to a higher height in the years to come. So we're so grateful for this. So we want to say a very big thank you to GAAPP for the opportunity once again. Thank you so much.
Thank you, Kelechi, and thank you for all that you're doing there in Nigeria. Great presentation. And while we're reading out some of the responses of the first question, I'll ask you to respond to this question. You've heard Kelechi's experience of engaging government for funding and support, as well as engaging schools. Have you done anything similar in your own advocacy communications efforts? So if you'll drop that into the Q&A or the chat at this point, as Kristen is monitoring that. And I'll go to a couple of the comments that were made in the first section around what is advocacy? What does it mean to you? So I love this response. It's being the voice for those who can't speak up for themselves. It's inspiring people to take action. It's social mobilization, engaging around a cause, especially for those that are in vulnerable populations. I love the fact that Asthma Canada shared the letter to their Minister of Health and their UN representative, that they're doing the work of supporting and pulling through the efforts of the lung health resolution. So thank you so much for sharing those. And again, we'll ask you to just share if you've had any similar experiences that Kelechi shared as we go to our second presentation, which is from Lakki Limbu. Lakki?
Hello everyone, Namaste from Nepal, the Himalayas of land. And it's almost 7 p.m. here in Nepal, so good evening from Nepal. So my name is Lakki Limbu and I'm representing Care Association of Nepal. So before I begin my presentations, let me give you a very brief reflect on the respiratory health in Nepal. So the problem with respiratory health in countries like Nepal, low, middle, and income countries can be broadly divided into two. First one is outdoor air pollution in cities and urban areas due to unregulated vehicular emission and unmanaged urbanization, industrialization. Second is indoor air pollution in the rural areas due to traditional firewood cooking practices aided by lack of awareness. So today I will share how we are fighting against this and how we are communicating through different advocacy channels. So yes, we are a youth-led organization, and our vision is to establish a healthcare system which is sustainable at the time, equitable also. So who are we? We are a team of dedicated medical public health. We do have nursing as well as paramedical health professionals, and we are here to bring positive change in healthcare delivery, medical education development, and public health initiatives. So we can move to the next slide. Hello.
Can you see this? Lakki? Got the how are you?
Hello. So am I paused?
I think it just froze for a second, Lakki. So go ahead. We're moving.
So as I said, we are a youth. So we are a youth-led organizations, and we empower youth we work for non-communicable disease, and for that we empower. So am I paused or?
We can hear and see you, Lakki.
However, my screen is being paused
Internet
for a while. So can I move on? Okay.
Okay, just keep going. Yes, keep going, please.
Okay. So, sorry for the interruption. So, our vision is to reduce the burden of non-communicable disease through youth mobilization, and our mission is to improve healthcare services and infrastructure, focusing in the rural Nepal. Okay, so next, please. So far, we have collaborated with GAAPP, Embassy of Ireland, Nexus Institute of Research and Innovation, Government of Nepal, and Nepal Stock Association. And for this opportunity, I'm thankful to GAAPP. Okay. So what are the advocacy challenges on COPD in Nepal? So Nepal is facing a high prevalence of COPD cases. Some of the data, some of the research are saying almost 22% of the Nepalese adults are suffering from this disease. So the challenges that we see are high COPD prevalences, as I said earlier, driven by indoor and outdoor pollutions. And at the same time, we have a very limited screening access, limited number of healthcare providers, and a very neglected focus on the respiratory health in Nepal. So how are we fighting against this? So we are incorporating a holistic approach through leadership, youth leadership training and mobilization of the youth, social media campaign launching, conducting school-based awareness programs, and conducting its community settings. But we don't stop over here. We always push for policy advocacy so that the solutions becomes more sustainable and the impact becomes long-term. So okay. So who are these NAYLs? So NAYLs are youth. Basically, they are youth. They are youth from various health sectors. As I said before, we are a team of medical public health. I myself am pursuing medical. So we are a team of mind-like youth, and every year we call out for NAYLs to join us, and we try to select youth from different corners and different communities of the country. The model of this NAYL is that a single person and a single organization cannot reach every corner, every community of the country. So what we do, we select youth from different corner, different community of the country, and we empower them to be youth leaders in their community, so that as our organization, we reach all the country, all the parts of the country, and we cover all the communities, so that our efforts reach the people in need, our efforts reach the community in need. So that is the basic model behind this NAYL. So having enrolled this youth as youth leaders, we train them, we capacitate them through different webinars, workshops, meetings, training, and we empower them to be youth leaders, so that they can lead now the so they can lead the activities in their community as youth leaders. And each youth leaders will is responsible, is liable to make his team of 10 NCD champions, so that the efforts can be disseminated to a greater extent. So these are some of the pictures we have when we're training our youth. So next. So our NAYLs are actively working in screening, in awareness campaign, in education, and we have a vision to recruit or to train 100 NAYLs, 100 youth leaders, and each annual will form a team of 10 NCT champions. Thus, we want to make 1,000 youth leaders, 1,000 advocates of COPD in the Nepal. So another powerful tool is launching social media campaigns. So basically, we launch social media campaigns on different occasions on the particular theme, and to ensure we get maximum participants, we make sure that we reward our winners and post their materials in our social media pages and groups. So this looks simple, but here is the real real magic or the real power of this campaign. See, let's say suppose you are participating in a social media campaign led by HCAN. The theme is COPD, a silent killer. Okay, so you are participating. That means you have to make the infographics or videos. So to make that infographics and videos, first you have to learn. You have to learn on COPD. You have to learn on its symptoms, signs, the ways of prevention, and then you can know why it is a silent killer. So when you participate, you learn, and when you learn, you share. So you will share your knowledge. You will share it with your families, your friends, and the people around you. And when we as can post your infographics, those materials in our pages, other people will see people engaging. So when others see people engaging, they will become curious, and the other people also want to know why why people are so much engaged in this COPD. They want to know more. They want to learn on it. So this is how a campaign can increase the awareness organically and more effectively. So these are some of the data we have, and some of the digital campaign that we have run so far. So so next, please. So yes, we believe in storytelling, and we have launched podcast in our YouTube channel. So with a series called Mero Katha, which translates to My Stories. And so far we have only featured health experts, but yes, we are featuring patient stories very soon. And yes, this is showing a very good response in terms of our own organizational reach, as well as the advocacy for patients as well as for general public. So can we move to next? So school-based awareness campaigns are another I have to say it's another powerful ways to advocate, and particularly for chronic conditions like COPD. So we believe that early detection leads to early diagnosis and imparts knowledge on prevention. And also children are multipliers. Through children, we can reach their families, through children, we can reach other children, their families and their communities. So just think, a child says to his mom, our firewood cooking is making us sick. So when a child says to his or her parents such sentences, the family members become more aware. Their behavior changes. So we, through this school-based awareness campaigns, empower children as advocates for their families and for their belongings. So, and also and also by this campaign, school can be the center for primary prevention. That is what we call in community medicine as prevention even before the presence of risk factors. So, so these are some of the beautiful photos we have captured, and our NAYLs have done a great job on this. Okay, so and finally, community-based screening campaigns. We do conduct community-based free screening campaigns in the high-risk areas. Not only that, at the same time, we also provide the community people with the counseling sessions through the medical doctors, medical professionals, and the ways to prevent it. And these are some of the photos from our recent camp where we have screened people from the Lalitpur. In the findings, we found that more 25% of the participants had deranged value of FEV1 by FVC ratio, and we made this after completion of the screening campaign. We report it to the concerned with the municipality, the concerned stakeholders, and after knowing this, they are now calling us. They are now contacting us to conduct more screening campaigns in their municipality. So. And they are very much aware that, and when I had opportunity to meet them very recently, they were very positive. They said that they have now realized the importance of the gravity of this problem, and I am happy. And as an organization, we are so happy that now people are realizing. Now policymakers are coming ahead to work on this. So basically, when you screen the people and you report those cases to those policymakers, they are going to listen to you. They are going to they are going to be ready to make changes. So these are some of the key outcomes we had so far. So we have trained 60 youth leaders, thus 600 NCT champions, more than 200,000 audiences through social media, and empowered and educated thousands of students and screened hundreds of people. So what can we learn from these advocacy communications? So what I personally advise is youth empowerment is a game changer. See, through youth, you can create a sustainable grassroots advocacy network, as well as you can reach the rural and the underserved communities, ensuring a long-term impact. So also social media is a powerful tool for advocacy. We can reach any number of people with minimal resources, and we can create a community for advocacy. So as I said, early education creates lifelong advocates. Through children, we can reach their families, we can reach their belongings, we can reach other children. So they are multiplier factor, and through educating children, we are making our future, our generations healthier for the upcoming decades. So make sure you incorporate education and counseling in your screening, so that it brings people to take action, people to change their behavior. And advocacy must target both communities and policymakers. That is the only way you can make your program more sustainable through policy amendment. And And yes, collaboration amplifies impact, and we are very thankful to GAAPP for this opportunity and for all the support, for all their generous support to improve respiratory health in Nepal. And yes, thank you. Uh, uh,
Thank you, Lakki. Thank you. Yes, great presentation. I love the use of working alongside, children and changing that next generation around their mindset of behaviors like smoking and air pollution, indoor and outdoor, and the work that you're doing there, and the importance then of translating that to policymakers. So the question that I'll pose back to you all on the line, we heard other examples of, like, from Vildana involving the Minister of Health in a soccer tournament for children with asthma on World Asthma Day. We definitely heard reinforcement about the importance of school programming. But anything that you've heard in these first two that perhaps you haven't done in the past that you say, this is something we need to begin to incorporate? I think one of the key things I heard from Lakki specifically is keeping it simple, right? If we can communicate in terms that are simple enough for even children to accept and to communicate back to their families, then we're creating those early advocates and changing the beliefs of the next generation that will ultimately change the behaviors of a society. So I'll ask you to drop in any lessons that you've learned from these first two or ideas that you've gathered as we go to our next presentation, which is from Gabriel Johnson from Brazil. Gabriel?
Hi, hello everyone. First of all, thank you, Tonya, Chris, and GAAPP for having me, for having Unidos pela Vida here. And also thank you, Lakki and Kelechi, sorry, for showing these incredible and awesome initiatives all around the world. We're very proud of to be a GAAPP member as well, and for them to help us with everything and doing moments like this. So I'm Gabriel Johnson, as Tonya mentioned before. I work as operation manager here in Instituto Unidos pela Vida, or United for Life Institute in a free translation. Next, please. So we were born almost 13 years ago with her, the person who is holding the dream, because this is a dream that she had when she was late diagnosed with cystic fibrosis, a rare disease around the age of 23. So in the first 10 years, we brought cystic fibrosis to broader audiences, and most recently, we broadened our scope of work to include other respiratory diseases and rare diseases in general as well. So it all comes with a very strong early story of life of Veronica, who is right there as well. Our mission is to advocate for people with cystic fibrosis, respiratory diseases, and rare diseases in Brazil. So we want to fight so they have all the best in terms of treatment, diagnosis, and everything. So because we say it's not about surviving, it's about living. That's what we are here for. Next. So we don't do this alone. I mentioned GAAPP, but we are part of a lot of different coalitions all around the world who help us, including in Brazil as well, who help us do the work that we can. So that's the part of GAAPP that we are very fond of. So next. So the case that I brought to you all here today is the importance of one crucial medication for cystic fibrosis patients that do a lot of good things, and all the things that are listed there is a target treatment, improves lung function, reduces pulmonary exacerbations, but it was highly cost in Brazil. It costs a lot of money to the free public health system. But it brings a lot of different things, but it brings one thing that is the best one. There is hope, because people say there is not the cure of the disease, because cystic fibrosis doesn't have a cure yet that is known, but it almost, that's the words from our patients. So it brings hope for all cystic fibrosis patients. And since a few years ago, we didn't have access free of cost for cystic fibrosis. So we had to intervene and do advocacy and awareness campaigns. So next. So our advocacy begins not in 2022, but 10 years before. So this is the timeline of the since the approval in our regulatory agency until it comes for everyone free of charge in the public health system, in the Brazilian public health system. It was 2 years, but as I'm going to tell you in the next slide, it began 10 years before, a decade before, because shortly after we approved, Brazil approved the first modulator, we already started with health education efforts, communication-based campaigns and contents in social media and websites and everything to prepare people to what was coming for them in terms of treatment and innovations. So, and how it all goes to their hands before because you have a medication and you want in a patient's hands. So next. Yeah, so we start building contents, text contents explaining all the steps and stages of the drug outside Brazil. USA approves everything. So, and then we have now a new treatment. So we became a campaign. So people knew what was coming in terms of new treatments for them. So next. There's a few examples of how communications can be used. And this one is how we build capacity. We promote capacity building to the audience, explaining how the process of health technology assessment was about in the Brazilian health system, so they can understand when the time comes. Next. We build videos, we produce videos and podcasts, texts, social media posts, and everything that was available at the time. Next. So the second moment of the advocacy action was the pressure for registration. We built a campaign, online campaign with few resources, just like Lakki told us, and massive impact. Because we just after the FDA approval, we had to bring this medication to Brazil. So we went to the industry, to the pharma industry that produces it, and said, now you have to bring it here. So we promote a very good campaign to get people from all over Brazil to press to build a pressure in the pharma industry so they can register the thing in Brazil, the treatment in Brazil. And a few months later, they did. They brought to the US, from the US to Brazil, the drugs to be registered here, so we could made available for patients. Next. That's some posts from the time, because it said that patients can't wait. We did this campaign because we found out that the process was stuck inside the registration process was stuck inside the agency because of some documents that the pharma industry didn't get them in time. So we built another campaign, say, please give the documents to the agency so the time could be less and less, and we can give the patients access to this treatment in Brazil. So we once again did another communications campaign because patients couldn't wait any more time to get the hands in the treatment. Next. In this whole time, besides communications, we were doing advocacy in the National Congress, in the Senate, so to engage all the stakeholders, the political stakeholders, and we were also producing evidence that we were presented to the Ministry of Health in Brazil inside it, so we can present them the current, future, and landscape of cystic fibrosis, what we have now, what's coming. So be prepared. We are preparing the patients to be involved and engaged in the health technology assessment process, and that's how we do this legislative advocacy and political advocacy, because we have to link the communications ones with the political advocacy all in once to get things done. Next. So also we did health technology assessment education and engagement with the patients and patient organizations, because every time that we have this process in Brazil, there's a few times the patients can go and say their opinion about the medication that being assessed. So before a public consultation was open, we organized events, webinars, education publications, booklets to enhance their understanding of this process, how it works, and to build qualified social engagement. Otherwise, patients would be engaged, but it wouldn't be a good one. It's going to be because we have to bring evidence to the process. So more than 1,000 people were reached by this campaign, and we also bring this campaign to the medical seminar, to the medical congress, Cystic Fibrosis Medical Congress, to discuss all these things there as well with the physicians that from all over Brazil. Next. So one the time the public consultation was open, we built another communication campaign, a massive one, because first the agency said that it was too costly. It wouldn't make it to the patients. But it was only a preliminary recommendation. So what we did was to reverse this decision. We activate all the patients and patients organization working with cystic fibrosis in Brazil, so they could in this public consultation, in this moment of they would be heard. They would be heard in this time. So we summoned them all to say that the medication should be available for everyone, free of cost, in the public health system in Brazil. So we built a lot of different social media assets. Next. This is the website that we built. It was like, how should I do it? Why should I do it? How can I contribute to the public consultation? How can I do it better? What is a public consultation? Everything, so they could understand what's happening. Informations about the medication, how they could assess it. Next. We also did a step-by-step in PDF and video on how to do it exactly. You click here, then click there, go to this link, and so you read this document so you can prepare and do the public consultation. Next. This was some social media assets that we did to promote the public consultation and how people should engage. Next. Also a lot of videos and reels, because we know that people respond more to videos, quick videos. So we did a lot of them so we could reach young patients as well. Next. And then the victory time came. We generate evidence. Because Veronica's, as the CEO of the organization, she was doing a master's degree, and she was studying in the university how patient contributions were being used in the cystic fibrosis health assessments processes, health technologies processes, so she can deliver to the in evidence to the government, saying, so people should be heard this way. You're doing fine this way, but people should be more engaged. But yes, this photo is a very iconic one for us, because there's the Ministry of Health, and there's the head of the Medical Society of Respiratory Diseases, and Veronica. So we were there sitting next to the Minister of Health, saying that that drug that we fought for over 10 years, 5 years, was going to be incorporated in the public health system free of cost for everyone. And it was a huge fight, but it never ends. It never ends, because after that they reversed the decision, approved the medication, but we have to fight to update the guidelines. We had to, now we're fighting to expand the label for more mutations, to include even more patients and rare mutations and kids less than 6 years. So it never ends. When it's a victory, everyone now can have access if they're eligible to the treatment, but we're trying to make even more patients eligible and have access to it. So everything, every letter, every communication, every campaign, everything that we did to ensure that the medication would be we reach everyone. So next. So my final words for everyone: we should educate and qualify the community through education and communication. Unidos pela Vida, our institution, is very known for the communication and the quality of it. So that's how we reach patients even more effectively. The simpler the explanation, exactly like Tonya said, the greater the chance of success. Making the invisible visible and communicate properly. We always say inside our organization that without understanding the processes, there's no efficient action. Without understanding the whole picture, there's no strategic action. So bring education to the patients, involve them in all the process. Sometimes it's very bureaucratic, but they have to know what step there is. No, there are the things. If without working together, there's no effective advocacy. Without partnership, there are no robust results. And without dialogue, there's no evolution at all. Veronica said a lot here inside it, that you have to bang the right pot with the right lead at the right time at the right door. Otherwise, you're not making advocacy the most effective way. So one thing that I say here is keep pushing. But knowing everything and reaching for the evidences that make the best of our work to better. So that's what I would like to say here today. Feel free to connect with me on LinkedIn. There's my email. There's also my WhatsApp, my phone number. So please, if you have any questions, reach me. And thank you for the opportunity again, Tonya and Kristen from GAAPP.
Thanks, Gabriel. Excellent presentation by all. Really appreciate this. I'll ask you if you do have any questions to drop them in the chat. We are limited on time. So what we will do is respond to those. You can also go to info@gaapp.org and ask any questions there. We'll follow up as well. And you've been given the contact information for Gabriel and other speakers. But I think that some of the key things that I've heard here today are you must tailor this to your setting, okay? So it's very different in Africa versus India versus Brazil versus perhaps, Europe or North America. So knowing your particular government and their systems, knowing how to activate your community, whether it be in primary children, primary prevention and children, whether it be in youth-led programming, whether it be community-based screenings, or engaging government and HTA bodies. There are very specific ways to go about engaging in these advocacy efforts with very simple, consistent communications. So I think we've heard wonderful examples. I love all the examples that have been given. We will make this available on our YouTube channel for each of you if you would like to continue to revisit it or come back to it for those examples. And again, we are just so grateful to our presenters as well as to each of you as participants for your time here today. In conclusion, you can find this and our other GAAPP recordings at gaap.org. Just click on education, choose the GAAPP Academy menu item, and there you will see that as well as on our YouTube channel. Again, thank you so much for your time, for all of your attention. We wish you well, continued doing the great work, pushing through, as Gabriel said, and we'll see you next time. Have a great day.
Thank you. Thank you.
Bye-bye.
Bye.